There are many people eligible to be living donors today, and one of the myths that we try to dispel is how easy it is and safe it is to become a living donor. Patients can donate a portion of their liver, which has the capacity to regenerate in as little as 6 to 8 weeks, and if they're a safe candidate, they go on to live a healthy, normal life. And it's also very safe for people to be kidney donors and save the lives, literally, of so many thousands of people who are stuck on dialysis. We find here at Yale Medicine that about 80% of the patients on the kidney transplant waiting list have a suitable living kidney donor that might work out for them. For a liver transplant, there's a lot more that goes into it. For not just the blood type, it's also the size and the anatomy, so that unfortunately only about 20 to 25% of patients who are on the liver transplant waiting list can have a suitable and safe living liver donor. The risks of living donation and transplantation are those of having surgery, which can be as minor as laparoscopic surgery, or it's as major as open liver surgery, where we have to make an incision under the right side of the rib cage. We have a success rate in excess of 98% for the recipients of these life-saving organs, and the donors in our hands at Yale Medicine have 100% success rate in having excellent outcomes, survival, and good lifelong organ function. Let me tell you about a great patient story that just happened recently. There was a woman who had cirrhosis, and she actually developed end-stage liver failure. Her son stepped forward to try and save her life by offering to be a living liver donor, but unfortunately, his anatomy wouldn't let him safely donate. So a friend of his from work, who heard about the condition of his best friend's mom, stepped forward. The son's best friend was able to go through a very safe operation, getting out of the hospital in merely 4 days, and his mom's entire life turned around in as little as 6 days, and she's an entirely new woman now, filled with so much joy and energy that she hadn't had in years. I'm David Mulligan. I'm Chief of Transplantation and Immunology here at Yale Medicine.